This is the test of the emergency broadcasting system. If this was a real emergency, you would be notified and sent to your local bomb shelter to hide out in a room with a bunch of scrappy ne'er-do-wells scrambling for a can of peas. Hi, I'm Dr. Chris Lebowski. I wanted to talk to you today about something I'm fired up about, that I spent a lot of time thinking about. And it's the idea that the average person doesn't have any idea about why they're sick. That the average person doesn't understand the root cause of disease. And that it doesn't make sense to them how they should be so unwell. That we should be in this middle of this epidemic of cardiovascular disease and cancer, which I predict is going to be a tsunami. That we've barely even seen the beginning of it. And that over the next 10 to 20 years, we're going to see this huge tidal wave of cardiovascular disease and cancer and infections like we've never seen before. And that people don't know why this is happening. They might have an inkling that in some way the cardiovascular disease is tied to diet and exercise, but that's a fairly simplistic answer. They have no idea why everyone has cancer. And to be honest, nobody's really asking the question. There's this pink ribbon brigade about finding the cure, but nobody's saying why. And how can you stand in the face of an epidemic and not ask the fundamental question about why it's happening? And I believe if you want to treat an epidemic, you need to understand its roots and why it's happening. So why do we have these two disease processes being the number one and number two killer in order, cardiovascular disease and cancer? Cardiovascular disease by a margin 4 times that of cancer, but cancer being the next leading cause of death. Why? It primarily lies in the concept of toxicity. That we have never been so toxic as a species. Our air, our food, and our water is all polluted with harmful chemicals. All of it. There is not a single patient that walks through my door that does not have some level of toxicity. We check, we look for heavy metals, for mold, for plastics, for PCBs, for glyphosate in our patients, and we find it in every single one. The same people who are the most toxic tend to be the ones that are the most sick. We see this over and over again. So much so that it's a red flag when someone comes in with multiple disease processes. They're heading towards cardiovascular disease as evidenced by elevated fibrinogen, homocysteine, C-reactive protein. These are all cardiac inflammatory markers. They come in with some type of diagnosed cancer. They come in with multiple infections, as most of the patients do that come through our clinic. This is a red flag to me to look for toxicity, and they all have it. So we have to figure out ways to either stem the tide of toxins coming into our body, which is extremely important, and how to detoxify from these things. Because if you don't, your immunological system is just shot. There is no way your immune system can work in the presence of all these toxins. We see it over and over again clinically. So much so that the basis of almost every treatment around here is to get started by detoxifying the patient for a certain amount of time and then going back and checking the markers and make sure those toxins are removed. When they do that, then their immune system can come back online and they can fight the cancer, they can fight the infections, they can overcome the cardiovascular disease or any of the other number of things that are going on with people these days. We have to teach people how to make sure that they're not filling up with more toxins. Since babies born today have somewhere in the neighborhood of 200 chemicals in their bloodstream when they come into life on this earth, we have to stem the tide of filling that bucket back up. So we have to try in our homes and our places of work to have clean air and clean water, and we have to choose foods that are the cleanest and have the least amount of chemicals in them, just to have a foothold into being able to climb this mountain of health in order to stay somewhere above the rising water line that's happening with these diseases. So it really does matter what you eat. It really does matter that you eat clean, organic food. It really does matter that the water that comes into your home is filtered and all the impurities are removed. It does matter that the air in your home or your town is clean. And so filtration in the home for the air, filtration in the sink for the water, both the ones we bathe in and what we put into our stomachs, and our food, they're all incredibly important. We have a great armamentarium of natural substances and plants that help detoxify the body too. So everybody gets put on these things. Because, as I stated before, if you're full of toxins, there's no way you're going to overcome those other health concerns. It doesn't happen. Those are the people that die, that we see die. They come in, they're too toxic, it's too late. They got to their health problem too late in the game, and their immune system has no chance. So I don't want this to sound fatalistic or hopeless. Instead, I want it to be a hopeful message that if you start today by mitigating the substances that come into your body and you start on a regular detoxification program, you can have a fighting chance at not developing heart disease or cancer or filling up with all the myriad of interesting infections we're seeing these days. And I want to thank you so much for listening today. Good luck and good health.